Hey all, it's just a short, quick podcast here on a chest X-ray that I found on Life in the Fast Lane. Life in the Fast Lane, by the way, is outstanding. It's take the initials LI FL.com and go there. They have hundreds and hundreds of chest X-rays, ultrasounds, write-ups on different things. I mean, it's just a huge site and just a great learning site. And they support free and open medical education, which is what I like to do, obviously. So I heartily recommend them and thank them for posting this chest X-ray. So anyway, we'll start, of course, with figuring out how to get my pen to work. All right, let's give it a shot now. So we'll start with, of course, A, B, C, D, E. A is for airways. And if we look at the airway, we can see, looks like the carina is right here. You can see the bronchus splitting off there and there. And then the trachea comes up like so. And B, look at bones. And you can see right off the bat that they cut off the apices up here, which isn't good. So it's kind of difficult to count ribs. You can see the first rib here, and it goes around like this. And of course it gets cut off so we can't really see. And the same on the other side. So I'm assuming that this is the second rib here. And then third rib, fourth, fifth, sixth, seventh, eighth, ninth, 10th. And if we follow the ribs around, I don't see any fractures on the left side. Make sure you look at both the posterior rib, which is this, and the anterior rib, which comes around here. And on the left side, follow the ribs around, posterior, lateral, anterior, posterior, lateral, anterior, and I don't see any fractures either. And look at the clavicles, what we can see of them, because they're cut off. I don't see anything. Look at the vertebrae. Looks like they're nicely spaced and even. I don't see any fractures there. And a little bone over here. You can see the shadow right here of the scapula. And right there is scapula. And I don't see anything in there. So let me get rid of these marks and we'll start looking at what else there is. All right, so we can see that this patient's intubated. And you can see the endotracheal tube coming right down here. But then it keeps going right about there. And you can see the carina is right here. So it looks like a right mainstem intubation. That's actually about right there. So we know that the ET tube is too far. It should be around 5 centimeters above the carina, so it needs to be pulled back quite a bit. And this should be somewhere around where it should be. Oh, you know what? I didn't finish. Let's look at C in the heart. Sorry, I got disoriented. Get rid of the marks. So we can see the heart here. And although it looks big, remember this is an AP film, so the heart's going to look big, as will the mediastinum look widened, and that's just what happens on AP films. And D, the diaphragms. Look here, here's a diaphragm. And over here's a diaphragm, but then you're like, because you can see this is stomach, but the diaphragm is actually a little higher. You can see here that there's a little bit of air under that diaphragm, a little bit of free air. So that's obviously pretty important. And over here you see a tube coming in. That's obviously a chest tube. And it comes down here and ends in that um, angle right there. So the chest tube isn't in the best position. You'll be able to get, I mean, if he develops into a tension pneumo, it'll obviously help, but it's not going to get any air out otherwise because the air is going to be mainly up in this area more than likely. So that chest tube should be repositioned, and it'll get blood out, and it should come up in this direction. So they really need to think about fixing that. Right, I got rid of some of the marks. It was getting kind of messy. Because I wanted to show this ET tube, it's right here. Or, I'm sorry, not the ET tube, the chest tube is right here. Which, as I said before, needs to be fixed. And you can also see an NG that comes down here. So it looks like it's in the stomach. And go on to E. Can't blow it up very much, but you can see lung markings, vascular markings going all the way out to the periphery there. And the same on this side. So there's no pneumothorax there. So I don't see a pneumo anywhere. So basically what it comes down to is ET tube needs to be pulled back, and chest x-ray, should think about repositioning that chest x-ray. Although the lungs seem to be fully inflated, so it might be okay just to remove the chest, or remove the chest tube. And then this free air here needs to be addressed and see what's happening or what's causing that. Is there a perforated bowel, etc. And that's about it. So 1, right main stem. 2, be aware of the chest tube and maybe repositioning or even removing. 3, NG appropriately placed. And 4, free air under the diaphragm. And that looks like about it. All right, I hope you guys enjoyed it, and please like and subscribe if you do.